What? All right. Good morning. The Senate Committee on Health, Education, Labor, and Pensions will come to order. All right. We did it officially. We've done that. All right. Now, the first order of business. What? All right, Warren, what? Okay. All right. I think we are going to maybe have a quorum later on. We may not, but I think we'll be able to proceed. Is that right?
I'm okay with that.
Okay. What I want to do today informally is to try to bring people together to get a discussion of where we would like to go. I've had the opportunity to speak to almost all of the Democrats, some of the Republicans, and I look forward to speaking to others to get a sense of what your priorities are. Obviously, there are going to be major disagreements on issues, and that's called democracy. But I happen to believe that there are going to be areas where we can work together. And I look forward, honestly, to doing that. So what I'd like to do now is just kind of lay out some of the ideas that I have, and then I'll give it over to the ranking member. He'll do the same. And then we'll go around the table, and people can take a few minutes to express their priorities. Let me begin by thanking Senator Murray. There are a number of hearings going on right now, meetings. She's not here. But I really wanted to thank her for the excellent work she did as the previous chair of this committee, and to thank Senator Burr as well. Patty held the chair in the middle of the worst public health crisis in modern American history, and I am amazed and appreciative of the incredible number of hearings she had on COVID and other related issues. So she deserves all of our thanks. The title of this committee is Health, Education, Labor, and Pensions. And obviously within that very broad jurisdiction, which impacts virtually every American, there is an enormous amount of work to be done. So let me tell you kind of what my priorities are within that broad scope of work. In terms of healthcare, in my view, we have a broken and dysfunctional healthcare system. We spend twice as much per capita on healthcare as do the people of any other country, twice as much. And yet we have 85 million Americans who are uninsured or underinsured. We have some 500,000 people every year who go bankrupt because of medically related debt. Just think about that for a moment. You get leukemia, bad enough, then you go bankrupt because you can't pay the medical bills. And on top of all of that, we have some 68,000 people every year who die because they don't get to a doctor on time because they can't afford to go to a doctor. And as bad as the general healthcare system is, the primary healthcare system is struggling even worse. And when I talk about primary care, I am including the need to address the horrific mental health crisis. I don't know about you, but I go around my state, and no matter where you go, to schools, to police departments, wherever you go, it's mental health. It is worse than people perceive it. It was bad before, and the pandemic has certainly made it a lot worse. So we need to look at mental health, and obviously the opioid crisis, which I know is hit New Hampshire very hard. It has now spread, thank you, we now have it in Vermont, and all across this country. We lost over 100,000 people last year to opioids. But on top of all of that, we have nearly 100 million Americans who live in areas where it is difficult to access primary health care. Nearly 70 million live in areas where it is difficult to find a dentist. And I want to talk, during the course of our time here, talk about dental care, which is a serious problem. And then we have 150 million people who are finding it hard to find a mental health provider. So the question that we want to deal with, and we're going to deal with it pretty soon, we've got a hearing coming up, is how does it happen when we spend so much money per capita on healthcare? We don't have enough doctors, we don't have enough dentists, we don't have enough nurses, we don't have enough mental health care providers, we don't have enough pharmacists. So that's an issue that I think we got to lay on the table and see what we can do about that. And I should say that in the midst of all of that, Patty, you're late. I said some very nice things about you. All right, you have to go look at the video, and all right. But despite all of those problems, the insurance companies made over $60 billion in profits last year. And then another issue that we will deal with, and I know there are divisions on this committee on that one, is it is my very strong view that it is a woman who has the right to control her own body and not the government. That is an important health care issue to many of us. And I believe the Dobbs Supreme Court decision was not only wrong, but way out of touch with where the American people are on this subject. In my view, we must codify Roe v. Wade and protect the reproductive rights of women. So yes, if you look at all of the issues in front of us on health care, we have an enormous amount of work to do there. Part of that issue is prescription drugs. And interestingly enough, we did a little bit of research on this, but as both former President Trump and President Biden have both noted, we pay by far the highest prices in the world for prescription drugs. And in some cases, we pay 10 times more than the Canadians and people around the world pay. What to me is totally insane. And I want to, and again, these are issues I hope we can come together on. Somebody here tell me if you think it's rational that somebody cannot afford a prescription drug their doctors prescribe, they get sicker, they end up in an emergency room, maybe they end up in the hospital, maybe they die. Does that make sense to anybody in any way? And I am more than aware, and let's be clear about this, we're big boys and girls here. The pharmaceutical industry has 1,700 paid lobbyists roaming the halls of Congress, former leaders of the Democratic Party, former leaders of the Republican Party, well-paid, sophisticated people. I have seen polls, I would say to my Republican friends, polls that were just done with Republicans. And you know what the top issue on the Republicans' agenda, at least in those polls? The high cost of prescription drugs. This is not a Democratic issue. It's not a Republican issue. The American people are sick and tired of being ripped off by the pharmaceutical industry, who make zillions of dollars every year, pay their CEOs exorbitant compensation packages. Question that the American people are asking us, do we have the courage to take on that power? And I would hope that this committee, in a bipartisan way, does. In terms of education, for years now, Senator Murray has been a leader in demanding that we address a child care system that is, in my view, in total disarray. In Vermont, it costs over $15,000 a year for a kid to go to child care. Think about it. How does a working class family afford child care, $15,000? And by the way, in Washington, D.C., it's probably twice that. All right? We profess to love our children, yet we have the highest rate of childhood poverty of almost any major country on earth, and a child care system which is disarray. People don't have enough slots. Many parts of the country, you can't get your kid into child care, and we pay child care workers abysmally low wages to do some of the most important work in this country. So this is not only an issue of kids and parents, it is an issue of the economy. People can't go to work, mostly women, if there is no available child care. I would hope very much, that we begin finally to address this issue. I know Senator Murray has worked so hard on it, but we're not going to let it drop. It's an issue that has got to be addressed. The other issue, and I'm going to be holding a town meeting on this on Monday night, is the low pay of teachers, public education in general. We are losing tens of thousands of teachers because of low pay and because of very poor working conditions. I believe strongly in public education. Teachers do some of the most important work in America, and they must be adequately paid. And on top of that, we must keep our promise to the disability community and our public school system, and fully fund the Individuals with Disability Education Act. And we look forward to working on that issue as well. And I know Senator Hassan feels strongly on that issue. I think we can all agree, and I think this is an area of bipartisanship. We want our young people, if you don't go to college, to be able to go out and get jobs in the trades. We desperately need plumbers and carpenters and electricians, and yet we don't have the training capabilities of doing that. We need to expand apprenticeship programs. I know there's something Ranking Member Cassidy has talked about, others have talked about. Let's see how we can work together on that. In terms of labor, health, education, labor, we are living in a country where 60% of our workers are living paycheck to paycheck, and millions are working for starvation wages. The time is long overdue to raise the minimum wage to a living wage. Federal minimum wage is $7.25 an hour. I trust that nobody thinks that that is acceptable. Further, at a time when workers all over this country are organizing unions, we cannot allow large corporations owned by billionaires, companies like Starbucks and Amazon, to violate federal labor law and engage in illegal union-busting activities. And that's an issue I feel very strongly about. People have a right to organize. We should not tolerate major corporations engaging in union busting. And among other initiatives, we must also pass the PRO Act. In the last Congress, the U.S. House voted to make sure that rail workers in this country had at least 7 days of paid sick leave. In the Senate, that amendment had the support of every Democrat but one and 6 Republicans. And I am pleased to report to everybody that as a result of mounting public pressure, a very large rail company, CSX, has agreed to provide some guaranteed paid sick days to some of their 5,000 workers. So we're making some progress on that, but these profitable corporations must be held accountable, and other companies must do the same. And rail workers are not alone. We must finally end the international embarrassment of the United States being the only major country on earth not to guarantee paid family and medical leave or paid sick days. Furthermore, in the year 2023, it is absurd that millions of women do not receive equal pay for equal work. We must pass the Paycheck Fairness Act. And there's another issue I would hope that we would have bipartisan support. Artificial intelligence and robotics are having and will increasingly have an extraordinary impact on the workforce. And we've got to take a hard look at what the workforce will look like in 20 or 30 years, and we intend to do just that. Pensions, last part, but not unimportant. We must do everything we can to expand, not cut, defined benefit pension plans in America, which unfortunately are becoming an endangered species. It is unacceptable to me that nearly half of older Americans have no retirement savings and no idea as to how they will ever retire with any shred of dignity or respect. Some of the other issues I want to look at is in an aging society, how do we improve the Older Americans Act? These are just some of the issues that I think that are out there. Bottom line is, if you look at health, education, labor, and pensions, these are issues that impact virtually every American. They are enormously important. Many Americans are giving up on democracy. They're giving up believing that their government can respond to their needs. And I hope that this committee, where we will clearly have disagreements, will be a place where people are saying, you know what, they really are talking about the issues that impact my lives. And maybe they disagree, they will treat each other with respect. It's called democracy. But I would hope that we will go forward aggressively in addressing the real issues facing working Americans. And with that, I yield the mic to Ranking Member Cassidy.
Thank you, Chair Sanders, and to the rest of you. This committee has jurisdiction to tackle a broad range of issues facing American families. And we're not always going to agree on the course, but we have the opportunity to have a good faith debate and meet where we do agree. And there's a long history of bipartisanship. Thank you, former Chair Murray, for us to live up to. First and foremost, we need to return to good governance. There is an extensive list of authorizations set to expire this Congress. It's important we fulfill our responsibility to get these reauthorizations done and done on time. The committee has also let authorizations lapse for a laundry list of bills that continue to be funded through the appropriations process. The money goes out the door, but we aren't checking to see if the programs are working well or could be refined or improved to better serve Americans. Chair Sanders and I have had a couple interesting conversations. One thing he said is he likes to spend money, but he doesn't want to waste it. If that is the ethic of this committee, we will be doing our job for the American people. For example, the Higher Education Act has not been reauthorized since 2014. The Workforce Innovation and Opportunity Act lapsed in 2020. Now, previous leaders of this committee hit snags trying to get this finished. I don't suggest it's easy, but we should do our jobs and work to get current on our authorizations. Child care and financing of student loans, 2 issues sure to come before the committee. I just heard that. Both are far too expensive for the families that have needed them and have only gotten more expensive as federal funding has been made more available. There is going to be bipartisan interest. If we choose to take it on, we must end the cycle of throwing money at problems and work to address the root causes that make education and childcare so expensive. One example, President Biden's student loan cancellation policy, now before the Supreme Court, is estimated to cost taxpayers $400 billion. Now, this is on top of the student loan repayment pause, extended 6 times under the Biden administration, so far costing taxpayers $195 billion. This has brought forward our debt ceiling crisis, this continued pause long after the public health emergency has effectively ended. So just last month, the administration filed a proposed rule on income-driven repayment that would eliminate the expectation for student loan borrowers to pay back even the principal on their loans, fundamentally breaking our higher education financing system. The administration estimates the plan will cost taxpayers only, or I should say at least, $138 billion over the next 10 years, but the Penn-Wharton budget model out of Senator Casey's home state and other nonpartisan experts have estimated that this plan could cost anywhere from almost 3 times that amount, upwards to $1 trillion. Now, make no mistake, these loan cancellation schemes do not forgive student loan. It transfers this $1 trillion in debt over the next 10 years from those who willingly took it on to taxpayers who chose not to go to college or worked hard and made sacrifices to pay off their loans. This is not only fiscally irresponsible, it is deeply unfair to the Americans whose debts look different from this group favored by the Biden administration. Where is the forgiveness for the guy who didn't go to college but is working to pay off the loan on his truck he takes to work? What about the woman who was responsible and prioritized paying off her student loans? Is this administration going to give her $10,000 for her mortgage? Probably not. If President Biden's goal is to solve the problem that college costs too much, I would point out that this massive government spending does nothing to address the reasons that college is so expensive. According to U.S. News and World Report, tuition and fees at private national universities has jumped 134%. Out-of-state tuition and fees at public national universities has risen 141%. And in-state tuition and fees at public national universities has grown the most, increasing 175%. The more federal aid Congress makes available, the higher these secondary institutions have increased their tuition. The administration hurling hundreds of billions of dollars at the problem is not going to solve it. There's evidence it only incentivizes schools to increase their tuition even more. We owe it to the American people to provide oversight, not rubber stamps, to the actions of the administration. An example, I was proud to join my colleague and a member of this committee, Senator Braun from Indiana, as he introduced a Congressional Review Act to overturn the Biden administration's environmental, social, and corporate governance fiduciary rule that would authorize asset managers to prioritize funding political causes over the success of their clients' retirement savings. There's just an article in Bloomberg that calls this greenwashing and that shows that this yields a lower return for the retiree and does nothing to decrease emissions. That is wrong. We're talking about the workers' money that they own and worked hard for. This committee should stand with those workers who are counting on a fiduciary to secure the best return as possible for them to have a financially secure retirement. This is exactly the opposite. The way it's currently being implemented is exactly the opposite of what the word fiduciary means. Now, an area where we all agree is a problem and have avenues to find common ground on a solution is lowering the cost of prescription drugs. We have to reduce the price Americans pay for medications. It is a priority. And we need good policy that considers all factors to come to the right solution. Dr. Marshall and I are doctors who have treated patients for over 25 years. Mine were uninsured. You've got to be conscious of the tension between affordability and innovation. People in this room are alive today who would not be alive were it not for medical innovation. And a component of this, that innovation is driven by profit. But we also have to recognize that if the patient cannot afford the drug, to them it is as if that innovation never occurred. As ranking member of the Health Committee and as a physician, it is a priority to not only protect Americans' financial health, but also to ensure the access and innovations that benefit their physical health. And this is an area where Democrats and Republicans can work together to benefit patients. The next 2 years of the 118th Congress has great potential for this committee. I look forward to the debate. I am pleased to be working with Senator Sanders, and hopefully we can together find those policy solutions that will be better for all Americans.
Senator Cassidy, thank you very much. What I would like to do now is move to a vote on accepting the rules. So our first order of business is to adopt the committee rules for the 118th Congress, and I move to adopt the committee rules. The clerk will call the roll.
Senator Murray?
Aye.
Senator Casey?
Aye.
Senator Baldwin?
Aye.
Senator Murphy?
Aye by proxy.
Senator Kane?
Aye by proxy.
Senator Hassan?
Aye.
Senator Smith?
Aye.
Senator Lujan? Senator Hickenlooper?
Aye by proxy.
Senator Markey? Senator Cassidy?
Aye.
Senator Paul?
Aye by proxy.
Senator Collins?
Aye by proxy.
Senator Murkowski?